formed a corporation. We've also partnered with The Gathering Place, and we are sponsored by Medical Mutual of Ohio. And Chris Austin from The Gathering Place is going to come up and spread the good word about The Gathering Place.
So can we have all the women of Show stand up and just give them a round of applause for being brave? These plays were written by these awesome women, and you know, it's just awesome to see how they've been able to take something as challenging as breast cancer and use it to help educate and advocate for women throughout the community. So it is a real honor to be able to work with each and every one of you, so thank you. And you're, you know, lauding the Michael Oatman and the actors, and they've done an awesome job, but none of this would be happening if not for you all. So I just wanted to take the moment to do that. You know, when I was growing up, my mom was a very, very strong woman. I don't remember seeing her cry until I was a junior in high school. She was very strong, and just, you know, it seemed like she took care of everything. And sometimes I think, you know, I never saw her ask for help about anything. So I grew up thinking that I had to be strong and do everything myself, and I think many women of color do the same thing. That it means to be strong that you can't ask for and receive help. And I have learned that that is not true. That it is courageous to ask for help and then to take that help and use it in your healing, because it's not just about healing physically, it's about healing the mind and the spirit. And that's why people come to The Gathering Place, because they need to heal the body, the mind, and the spirit. And they realize that it's okay to ask for help, that it doesn't mean you're weak. It means that you realize that you can't do everything by yourself. And that in order to be the strong woman who is a mother, a sister, a wife, a good friend, that it's important to be around people who can help support you through information, through education, through the support group like you heard Denise talk about in the play today. So at The Gathering Place, we have a multitude of different programs, because we know that everybody copes differently. Not everyone wants to come to a support group. Sometimes people need to talk one-on-one, or sometimes they want to know, how can I help my child deal with the fact that mom or dad has cancer? And so we work with children, we work with teens, and we do exercise programs, and we do healthy cooking classes, and we have a lending library that has a medical librarian so you can get information, so that when you spend that 15 minutes with your doctor and you still have tons of questions, you can come and talk with our medical librarian who will do research for you, and he'll say, these are the things that you need to follow up on your doctor with. One of the great things about The Gathering Place, besides our awesome programs, is that everything that we provide is free of charge. Free. So you don't have to worry about, does my insurance cover this? Can I afford the copay? Unfortunately, you've already paid the price because you have a cancer diagnosis. So what we want you to do is just walk through the door so you can be a survivor like these awesome women that are here today who've written these plays. So we have a table outside that has lots of information about The Gathering Place. So I would venture to say that probably everyone in this place today knows somebody that has been touched by cancer. So please take this information, share it with them, whether it's you or someone you love, and please tell people about these awesome plays that we've been doing. And if your church or organization would like to have shows come to you, then please see Bernadette so that we can come out and share.
We'd like Sabrina to come up and talk about the breast and cervical cancer prevention program real quick, and also later Mary from Project Tempo and University Hospital, and Deborah from Cleveland Clinic. We'll keep this moving real fast just so you can get this information, because we're supported by a lot of groups. We have Cleveland Clinic and University Hospital working hand in hand. side by side to make sure that we're getting the message out. So all of this synergistic connectivity we're using it to make sure that we get the message out. The message is to save our sisters' lives. Early prevention is the best cure, and to get your screening done in time. Okay, Sabrina. Thank you.
Good afternoon. My name is Sabrina Heath, and I am a 7-year breast cancer survivor. And I'm also a member, one of the founding members of the Survivors Helping Other Women Survive. And the main reason I'd like to talk to you today is there's a program called the Breast and Cervical Project. This is for women that do not have insurance, and it can be very devastating when you're diagnosed with a breast cancer diagnosis. I actually had lost my job when I was diagnosed with breast cancer. Plus, I was a primary caregiver for my mother. And when this came about, I was just like, oh my God, what am I gonna do? How am I gonna pay for this? And I was very blessed to come across the program called the Breast Cancer and Cervical Project. And believe me, they took care of me. They put you on a special Medicaid program, but they take care of surgery, chemotherapy, radiation, and anything else that you need in addition to. They take care of it, and you don't have to pay for anything. Okay, so I just like to let people know that the barrier of not having insurance should not stop you from trying to get help when you're diagnosed with cancer. We live in a town where we have wonderful programs through Cleveland Clinic, through university hospitals, through Metro Health. Don't just sit on a breast cancer diagnosis and don't follow through. You have to detect it early on in order to have a high survival rate. So that's what we really like to get across. And with the Breast Cancer and Cervical Project, this is a program that's through the Cuyahoga County Department of Health, and it's for women that are 40 years and older. There's no cost for mammograms and Pap tests. But you must have limited income or be on no Medicare or Medicaid or have no insurance, and you must live in the Cuyahoga, Geauga, Lake, Lorraine, Medina, Ashtabula, and Trumbull counties. So once again, you need to know there are resources out there for you if you're diagnosed with breast cancer. Please, please, talk to someone, talk to your doctor, talk to your family, someone to let them know about your diagnosis, because there are programs that can help you, especially if you do not have insurance. And once again, early detection is your best prevention. So if you'd like more information, there's information out on the table, or if you'd like to talk to me individually, that's fine, but I can certainly give you more information about the program. Thank you.
Hello everyone, this is such a powerful play. And I work for NEON, which partnership with UH, and what I do at NEON, give you a brief one, I work with the Mammogram Connection, so I get all abnormal mammograms and I refer them out to UH, Metro, Cleveland Clinic, so they can get their ultrasounds and biopsies. And I must say yesterday I had a call from our Department of Radiology with a young lady who showed up to the doctor who had her breast removed 5 years ago and had not been back for a follow-up since. Which was really sad to me that she didn't want to know again. And so yesterday I worked for about an hour trying to figure out where her film, she didn't know where she went for her last mammogram. She didn't know pretty much anything. So I did finally track it down to Euclid Hospital. I didn't even want to chance her going to pick up her own mammogram. That's something that I do. Also do that for the elderly. A lot of them feel that when they get older, that they don't have to have mammograms no more. And so they don't know, the older they get, the chances become increases. And so a lot of them didn't want to come pick up their mammogram. So what I do is I take them all to UH. There is no excuse. I'm the patient advocate, and that's what I do. I navigate whatever I have to do to get the ladies there, that's what I do. The other job I do is with Project Temple, and I work with Bernadette, and I must say I've listened to her talk, and she always says in her speech that I am in the moment. And so I've taken that into my own life, is being in the moment to get stress-free. And now that I'm here, that's what she says. And I don't think about anything else but being right here. So with that, we go out with Project Temple and we go to wherever it's needed. We do a lot of senior buildings, the federal building, and we do breast cancer awareness. We do we do a project where we talk about breast cancer awareness and getting your mammogram on time. So I'm just really glad to be here, and thank you.
Thank you, Mary. Thank you, Sabrina. Cleveland Clinic, they have a table out front, but they're away from their table, so we're going to keep moving on.
Bernadette, would you remind people about the fact that they can sign up for free mammograms?
Outside at the table, you can sign up for free mammograms. Cleveland Clinic has a table out there. University Hospital has a table out there. And also there's some information from the Breast and Cervical Cancer Prevention Program that's out there too. So there's a lot of information to make sure you get your free mammogram so you don't have a reason not to get it. It honestly takes about 2 hours to see a doctor for your clinical exam and to get a mammogram and a follow-up afterwards. 2 hours for the whole year. And you know, some of us have standing appointments at our hairdresser and our nail techs every 2 weeks. Okay, so 2 hours out of the whole year. That's not a lot to ask, and that could be the reason that you save your breast and or save your life. So I like to make a big deal out of it and have something arranged afterwards, or lunch or just a celebration. I celebrate the fact that I'm taking care of myself. Okay, real quick, let's just test, throw some statistics out there. There are over 232,000 new cases of invasive breast cancer diagnosed every single year. That's invasive breast cancer. That's not counting non-invasive breast cancer. That's a lot of breast cancer. And that, like in the play From a Misery to a Ministry, Black women get breast cancer less than our Caucasian sisters, but we die more from it. Does anybody know why that is? Did I hear fear? Lack of health care. And definitely fear, not wanting to know. Like, I got so much stuff I have to do, I can't do one more thing. Or I don't want to know because I don't want to deal with it. Or I'm just going to pray. And God will take this away from, I'll be fine. You have to get your screenings once every year starting at 40, and if it's in your history, then maybe you need to start at 35. And there's no other way to say that. We need to make sure that we're just being more proactive about our breast health. And we're all living proof that early detection is the best cure, because none of us, as survivors helping other women survive, are telling our stories from the grave. We're here. And a matter of fact, one of our ladies who's not here today, had a baby 9 months ago, breast cancer survivor. And not only did she have her baby 9 months ago, but she had her baby at home. Wow. So hopefully these plays have our purpose, our mission is to make sure that we're getting the word out about breast cancer prevention, about breast cancer, even though it can't be prevented. And we can go into that real quick, like, are there ways that you can maybe make it a little bit better for yourself where maybe you won't get a breast cancer diagnosis? Is there things that we can do? Any examples of things that we can do? diet. Diet, exercise, and reduce your stress. You know, just even some things like making sure you get enough sleep, reduce the toxic thoughts that you have, even being around toxic people. I don't even let people yell at me anymore. Just honor who we are, and just like when Mary was talking about Project Temple, our bodies are our temples, and we just have to just make sure you take care of yourself, mind, body, and spirit. And exercise, and when we mentioned that, is very, very important. Know your family history, and also, okay, I'm all over the place. I want to wrap this up. Sorry. Support your immune system with reducing the alcohol and reducing or eliminating red meat and dairy, because that's associated with the red meat, and also and boost up your antioxidants like in teas and berries, fruits, and that way if you can support your immune system, you're in better shape, because we get breast cancer, we get cancer cells all the time in our bodies. What happens is if your immune system is strong, it will go in there and check all of the cancer cells. But when your immune system is tanked, then it just can't. And then the cells just start dividing and multiplying, dividing, and then the cancer is spreading through your body. So that is one thing that we can do. Keep your immune system boosted up. Okay, so we're gonna have a raffle outside for 2 gift certificates to Dave's Supermarket. And we're also going to have a raffle. Cleveland Clinic is raffling off a blanket and also a sports bag. We have healthy food. We have vegetables and hummus and crackers and cheese and just a little bit of cake, because, in moderation, because sugar is another one of those things that really depresses your immune system. And not just sugar, but it's simple carbs like your cookies and cakes and pies and crackers and white flour and anything that breaks down into sugar, and alcohol is in that category too. So we have a little bit of sugar just in moderation, and also all of the information that we have outside with the tables out there, just to make sure that you got some good take-home information to pass on to your family, friends, relatives, co-workers. We are our sisters' keepers. And I want to thank you on behalf of Survivors Helping Other Women Survive, The Gathering Place, and Medical Mutual of Ohio, and our supporters from Cleveland Clinic, University Hospital, and Neon. Thank you. Thank you for coming out and sharing part of your afternoon with us on this foggy day. And we will see you outside for refreshments and more information. Thank you. Oh, I'm sorry, a quick question?
Well, it's more of a statement.
Okay.
My name, everybody can hear me? Usually I don't need a mic. I'll introduce myself. My name is Edna Maddox. I live here in East Cleveland, and I am the membership chairperson of the Friends of East Cleveland Library.
Oh, nice.
And I'm here because I wanted to attend this to get information. My oldest daughter, I'm the mother of 6 daughters. I'm a 4 of twins. And I'm 82 years old.
Wait, let's just take a moment there. Wow.
My oldest daughter, who retired from DFAS 3 years this July, she was happy to retire for 32 years. And of course, so much that has been said, I see associated with her. Doing everything. She has a son and a daughter. Daughter 27, a son 24, and a husband. And so since she's retired, she's doing more for them than, because they're both of those adult kids are still at home. And it's so true that we take care of everything and everybody else. I mean, this should be her time after 32 years. Mm-hmm. Now, something happened out of the blue. Last part of January. She called me and she says, Mom, she says, I have breast cancer. She just turned 58 in November. Well, we don't have a history of breast cancer in my family. I have a niece who has breast cancer, but she's the only one that I'm aware of. So that hit me, like a ton of bricks. She has a good attitude about it. She's gone for all the, tests and all of that, and they discovered everything, and we went with her. Her surgery scheduled for Tuesday, St. Patrick's Day. Yes, at Cleveland Clinic. And I told her about this, and she did know about it on the computer, but she had a full day, choir rehearsal early this morning, then her growth group was at 2, and she called me later. She said, Mom, I'm going to get down to the library because I'm just so tired and I got some things to do. So I said, well, I'm going anyway, I plan to. So I'm so glad to be here. This is a lot of information, and so much identifies with her, you know, what she's going through. However, she has a good attitude for that. She has always eaten pretty healthy and everything. So, you know, I said to myself, you know, where did this come from? And of course, as a mother, I'd say, Lord, I wish it was me instead of her, you know. But she has good support, and this has been so encouraging. And I do want to talk to someone about perhaps bringing this to our church, Abundant Grace Fellowship. We're up there in the Lutheran school. That's where our service is, and we have a special thing on every other month on a Saturday. So I'll talk to you about that, because this is so, and our pastor's wife is a cancer survivor, and one of her longtime schoolmates is a cancer survivor for 13 years. So she has a lot of support, but we need to hear this. You know,
Thank you.
so much.
Thank you. Thank you so much. And you did touch upon the breast cancer it's not running in your family, but history starts someplace. So that's why we just have to make sure that we get our screenings done on time. And please introduce your daughter to the gathering place. That place was a godsend for
You
me.
know, in some of her visits at Cleveland Clinic, they have gone over all of this, you know, with
Okay, great.
but I'm going to get material. But I just want our greater congregation to hear this, you know. It's been so wonderful. And I just want to say, all of you ladies are so articulate. I can understand every word.
Thank you. And one other quick little tidbit, maybe it's not a known fact, just a quick question. Do you know how many different types of breast cancer there are?
15.
Who said that? Oh my, yes. There are 15 different types. A lot of people just think breast cancer is breast cancer. It's not a one size fits all. So if you hear somebody else's story, you cannot compare what's happening with you with them, because for one thing, there's 15 different types and we all have different immune systems. So your journey is going to be just that, your journey. So all this knowledge is power. And a good attitude is an excellent thing to have because of the whole mind, body, and spirit connection. Yes,
You
Chris.
know, I just want to say, I'm with the Gathering Place, and we are doing this project with shows, but the Gathering Place works with anyone with any type of cancer. It's not just breast cancer. And we work with men, women, children, and teens. And so any type of cancer, we work with you at the Gathering Place. So I said men and women up there, but I just want to reiterate, it's not just for people with breast cancer, because we know that there are people dealing with all types of cancer. So I just want to say that, so if you know someone who's dealing with a different type of cancer, they're welcome to come and use the free services at the Gathering Place.
Yes, Denise.
Of the 15 types of cancer, is there one or more that's peculiar only to African American women?
She said,
Is there one or two that's more prevalent in African American communities?
triple negative. Triple negative breast cancer, you see it more in African American women. It's a very aggressive cancer. What did you say? Triple negative. It's called triple negative breast cancer.
But it's not a death sentence because I was diagnosed with triple negative breast cancer. And what that means is it's not estrogen positive, it's not progesterone positive, it's not HER2 positive. The others are too much estrogen, too much hormones, and the HER2 is a too much protein. And with triple negative, it's estrogen negative, progesterone negative, and HER2 negative, which means that there's no targeted treatment for it. So the chemo is kind of like a stab in the dark kind of thing, like we're going to give you this regimen and we hope it works. It's not like a lock and key kind of thing. There's no real cure for cancer, but they do have a good protocol for triple negative breast cancer survivors, and yeah, it's working for me. So, yes.
I just wanted to say that I'm a 31-year cancer survivor, so.
So hopefully you can go out in the community and spread the word that, because before we used to think it's a death sentence and we don't want to tell anybody about what's going on underneath our clothes, but it's not even that. Knowledge is power. And then get the support that you need, especially from the Gathering Place. That place is a godsend for me. Okay, let's go eat.